Okay, regarding the thyroid status examination or thyroid gland examination, really if the order of the examination committee is to examine the thyroid gland, you have to check the thyroid gland only, while thyroid status of the patient means the examination peculiar to the thyroid gland dysfunction or the effect of the thyroid gland dysfunction upon the system of the body. Really, to simplify these steps, you have to know that the thyroid gland examination is just like any other general examination, and we have to approach them by general look to the patient and regional examination. General look of the patient, you have to determine the age group of the patient, sex of the patient, the awareness of the patient, and the decubitus of the patient. And after that, you have to know whether the patient is comfortable or not, irritable or not, dull appearance, lethargic, and so on. And after that, the body bulk of the patient, and last, whether the patient is dyspneic or having stridor and so on. All these parameters can explain some finding in the thyroid gland. After that, you have to check the patient regionally. Well, let's start from the hand as we have learned from the general examination. Really, let's see the dorsum of the hand. Patient with hypothyroidism, for example, may have a dry dorsum, while patient with hyperthyroidism may have warm, or what we call it silky hand, moist hand. After that, determine the temperature here, and then the nail. For example, for thyroid acropathy or onycholysis, separation of the nail from the nail bed. After that, determine the palmar surface for palmar erythema in the patient, and then ask him to perform the tremor procedure for a tremor. Okay, to see whether the patient had a tremor or not. After that, you have to determine the radial pulse as we have learned on the vital sign examination, and to see how much the rate, the rhythm, volume. And after that, you have to check for the collapsing pulse. For example, patient with collapsing pulse may have a state of volume overload in case of hyperthyroidism. After that, you have to check the hair of the patient for texture or any loss. Patchy loss may occur in patient. For example, in patient with hyperthyroidism, thick texture of hair may occur in patient with hypothyroidism. After that, you have to check the eyebrow. Loss of eyebrow may occur in patient with hypothyroidism. Really, after that, the next step is to check the eye signs. This may be a part of the general examination or examination or status of the thyroid gland examination, or could be an order from the examination committee is to check the eye sign for the thyroid gland. Regarding the eye signs of a patient with thyroid dysfunction, or if we would like to check the eye signs in patient with suspected thyroid disease, in the following way really the examination is conducted. First of all, sit in front of the patient and to see his eyes, especially the eyelids with the cornea. As we see here, okay. As we see here, the lower eyelid is just at the inferior limbus, at the inferior border of the cornea, while the upper eyelid midway between the pupil and upper border of the cornea, which is the normal. Patient with lid retraction, the upper eyelid will be elevated and the sclera will be visible from above, while a patient with exophthalmos may have either visible sclera below or the sclera will be visible from above and below. This is the eye sign from the front. After that, we have to check for a proptosis from the side, which is a protrusion of the eyeball for both eyes. And then we have to check whether the patient had lid lag or not by asking the patient to follow the finger or a pen several times after stabilization of the head. حماد هسه بدون ما تحرك لنا راسك. بعينك تباوع الإصبعي راح يصعد وينزل. أوكي. several times slowly to see any lid lag. If the patient had lid lag, the following will happen. For example, in this eye, this eyelid will lag behind. This is what we call it, lid lag. After that, we have to check for the also proptosis and that accompany exophthalmos from behind the patient. And I'll see really from above superciliary ridges from here till the cheek of the patient. There must be no protrusion of the eye. Any interference from the eyeball in this plane of vision indicate proptosis. After that, let's return back from the front and to see the eye again. First of all, I'll ask the patient to bend his head down. تنزل راسك هيك، ترفع عيونك لفوق هيك، ترفع لفوق to see for the wrinkles. Absence of wrinkles indicate exophthalmos here. هسه على راحتك. After that, I'll check the following. باب ورا اصبعي، باب عند هنا. I'll check for any conjunctival or watering of the eye, conjunctival congestion, corneal ulceration. This is due to overexposure of the cornea and conjunctiva because of inability to close the eyes in patient with exophthalmos. Also, the contralateral side should be checked. Okay, عشتيدك. After that, we have to determine roughly the pressure in both eye. بس غمض عيونك. To check just the pressure in both eye. عشتيدك. After that, we have to perform the H test and asking for any diplopia and to see any limitation or any nystagmus. تتابع لنا اصبعي وين ما يروح. شوف لنا اياه، واي مكان تصير بالصورة اثنين تقول لنا بيها. اوكي، ماكو مكان حسيت بالصورة اثنين اشتدك. And we have to see the nystagmus or any limitation in movement which was absent. After that, we have to determine the near accommodation reflex. هسه تباع عندنا اللي قدام على مثلا الزاوية مال الحائط. هسه تباع عندنا على القلم مالتي. Okay, to see the convergence, the ptosis and meiosis. Patient with exophthalmos اشتدك. Patient with exophthalmos had limitation in the convergence. All these really are the signs of or eye sign in patient with thyroid dysfunction. After the thyroid gland examination, you have to descend down to see also the lower limb. In the lower limb, also check for any dryness or pretibial myxedema or myxedema here. Also check the temperature roughly here and check for edema as we have learned in the general examination and how to perform them. At this moment, you have to put in your mind the following. First of all, you have to check for the reflexes. Hyperreflexia and declonus may indicate hyperthyroidism, while delayed relaxation reflex occur in patients with hypothyroidism. This is one. And then you have to check for proximal myopathy that occur in both hypo and hyperthyroidism, especially in patients with hyperthyroidism. And after that, you have to check for cerebellar ataxia in patients with hypothyroidism in the following way. I'll choose, for example, the knee reflex. The knee reflex, and we have to check it. Okay, to see whether it is hyperreflexic or not, and I'll check the other side. Okay, after that we have to perform the maneuvers for the clonus. First of all, the knee clonus, slightly relaxed, and then to press. If the patient had a clonus, you will see the following. You will see that the patella and the quadriceps will be contracted as long as you perform this position. After that, you have to check for the ankyloclonus by flexion slightly the knee and elevating the whole leg and dorsiflexion with eversion. If the patient had a clonus, you will see this. After that, I'll ask the patient to sit at the end or at the side of the bed to check for the delayed relaxation reflex in the ankle joint. هسه بس حماده تقعد لنا هناك بس طلع لنا رجليك هنا تقعد بالعافية. Okay, I'll check the ankle as we see here. You will see dorsiflexion and then plantar flexion. This maneuver or this position is designated check for a patient for the delayed relaxation reflex and what we call it hang up reflex. هسه براحتك تعال هنا حماده. And then I'll check for the proximal myopathy straight. Ask the patient to sit and then to stand without help from his hand. إذا بدون ما تستخدم إيديك توقف هنا. Okay, if the patient had a proximal myopathy, he will be not able to stand, and after that you have to check whether the patient is able to walk or not. هسه على هذا الخط تمشي لنا. اي تمشي لنا. اوكي ترجع لنا. اوكي هسه على راحتك. Really all these issues and these goals are required for the thyroid status examination. Okay, the next step, let's go down, is to check the thyroid gland. The order of examination is either a part of the whole status examination of the thyroid or just to examine the thyroid gland. Really, the thyroid gland is examined just like any other part in the system examination. The examination consists of inspection, palpation, percussion, and auscultation. First of all, I will check and inspect the thyroid gland here and to see whether it is enlarged or not, and to see any visible neg that may indicate obstruction. After that, I have to ask the patient to swallow. تبلع لنا رقيق حماده. Okay, حماده شوي مي. If the patient was unable, or for better demonstration, we have to give him or provide him with some water. تبلع لنا رقيق وأنا باوع رقبتك. عشت ايدك. Because of the attachment of the thyroid gland to the larynx, the thyroid gland will be moved with the deglutition. Absence of this descent may indicate inflammation or neoplasia. After that, really after inspection for the thyroid gland, and we have to ask him to protrude his tongue. هسه بس طلع لنا لسانك. If there is any swelling appearing here with the protrusion of the tongue, this may indicate thyroglossal cyst. If the patient wasn't able or the thyroid gland wasn't so visible, especially in patient who is obese and short neck, we can use Basilos method. حماده بس تشبك لنا صابعك تخليها على رقبتك وهيك. اوكي عشت ايدك. And to see the thyroid gland here عشت ايدك هاي. The next step in the examination is palpation. First of all, I'll palpate for the thyroid gland, pressing from one side and palpate the other side. Also ask the patient to swallow. ابلع لنا ريقك. عشت ايدك. After that, we have to check the carotid pulsation, if it is in its place or displaced due to thyroid enlargement, and then to detect the trachea and the posterior, and the posterior cervical lymph node. This is palpation from the front. After that, I will palpate from behind. Also, I'll press the hand slightly the neck of the patient, and I'll press from one side just like this. I'll press from this side and palpate the thyroid gland from this side. Also, I'll press from this side and palpate the thyroid gland here. Also, I'll ask the patient to swallow. تبلع لنا ريقك. عشت ايدك. Also, I'll check for the whole remaining cervical lymph node, as we have learned in the general examination. نجنح شوية. عشت ايدك هاي. عشت ايدك. This is all about the palpation from the behind. After that I'll ask the patient to perform Pemberton sign بس هسه ترفع المديك. Okay, this is Pemberton sign. Let's wait. Patient who have retrosternal extension of the thyroid, he will develop cyanosis, congestion, edema of the face with this sign. هيا عشتي نزلها. Really, when the thyroid gland became visible and palpable, you have to also to give her or to give the examination committee some characteristics about the thyroid gland in the form of the shape, the size, any lymphadenopathy, attachment, that's to say the mobility, whether the thyroid is tender or not, and consistency. This is about the palpation of the thyroid gland. After that we have to percuss. In the percussion we have to percuss the lower part of the thyroid over the clavicles, sternum, clavicle, and upper chest, over the sternum and upper chest. And the dullness here may indicate that the patient had thyroid extension, retrosternal goiter. After percussion we have to auscultate. The auscultation you have to look for bruit, which indicate hypervascularity of the thyroid over both lobes of the thyroid. If the breathing interfere with your hearing, you can ask the patient to stop breathing. بس اقطع نفس شوي. عشت ايدك وخذ نفس براحتك. هسه اقطعه. عشت ايدك. Really listen for or over both thyroid glands. This may indicate hypervascularity and Graves' disease. And you have to put in your mind that we have other pulsation in the neck in the form of venous hum and also in the form of carotid bruit due to atherosclerosis, and you have to know how to differentiate between them. This is all about the issues and the skills required for the thyroid gland examination.